numerous types of hernias, and you don't necessarily have to have surgery to fix a hernia if it's not bothering. Certainly if a hernia hurts or keeps getting bigger, we think people should be thinking repair. The natural history, though, of most hernias is over time they get larger, and at some point they will start to cause pain. I've had patients who've known they've had a hernia for 30 years and then had to have surgery. A 94-year-old man had to have bilateral hernia repairs because his hernias then started to bother. It would have been easier on him at 64. He actually did great. We did him laparoscopically, and he went home and was back in his garden in 2 weeks. But again, typically hernias that bother, I always sometimes say, well, your body's kind of telling you there's a problem here. It hurts, it's uncomfortable, and then you should fix it. The risk of hernias are, again, hernia is a hole in the abdominal wall, is that the intestine can get in there, and then if it gets in too tight, it will squeeze off its own circulation, and then it will die. And it's called incarceration when it's stuck, strangulation as the tissue starts to die. Well, that's like a heart attack of the intestine. It's very, very painful. It's 8 to 12 hours of severe pain. It's not like a light switch, so you have some warning. But if patients would push the hernia back in, they could avoid emergency surgery. But that's what you're trying not to have happen. Statistically, it's a low risk. It is a risk for infants. Hernias in infants are urgent because they can't tell mom and dad they're in trouble. Also, with people with dementia in a nursing home, if they're not watched closely, if they can't complain anymore, they oftentimes will come in with an incarcerated strangulated hernia because they have their dementia. They can't talk to people. But most people can walk and talk. They can avoid that, but that is a risk. Unfortunately, too, as we age, our fascia weakens after age 40. No matter what we do, we can be pumping iron, lifting weights. Our muscles are good, but our fascia just keeps getting a little bit weaker. And what that means is things will stretch. So our holes will get bigger. So that's the natural process of aging. So, and there have been studies that have shown that in your 60s, if you have a hernia, it doesn't hurt. Within 5 years, 70-some% will. So it kind of gives you an idea over time. Most people will start to have problems with their hernia.